So you know that purine or pyrimidine, they are very, very important compounds. They play a very important role in the formation of your information molecules like DNA and RNA. And also you know that these molecules have nitrogen components. A major component of this molecule is the nitrogen component. And nitrogenous compounds always tend to be more toxic than other compounds. So any failure in their degradation or their synthesis will ultimately have some clinical consequences. So let's talk about those consequences. One of the diseases which is caused because of the failure in the metabolism or defect in the metabolism of purine is the Lesch-Nyhan syndrome. This is again a genetic disorder. As in the case of many genetic disorders we have been studying, it's also a X-linked recessive disorder. It is caused by HGPRT, ribosyl transferase. Biochemical consequences of this disorder include that, your body cannot salvage the hypoxanthine or guanine. You cannot use the the products of the nucleic acid or the diet degradation to salvage process, which will eventually lead in the formation of hypoxanthine and guanine. Because they are not being salvaged, what will happen that ultimately they will then be degraded, and this degradation then will eventually lead to the formation of excessive uric acid. Uric acid will start accumulating because your nucleotides are not being salvaged. Symptoms include the hyperuricemia, that is more and more uric acid is prevalent in the or accumulated in the blood, and of course the uric acid stones in your kidneys, which definitely have some real repercussions. Then there's gouty arthritis. Gout, we will see in the coming section that how gout is produced because of this hyperuricemia. And then there are motor dysfunction or cognitive deficits. Both are neurological disorders, one way or the other. Gout is one of the major consequences of the defects in the metabolism of nucleosides. Genetic mutation in the PRPP, that is phosphoribosyl pyrophosphate synthetase, which is involved, you have already seen when we were talking about the synthesis of purine and pyrimidine, that this enzyme is very important in the formation of the ribose sugar moiety, which will then ultimately become a very important component of your nucleoside. So genetic defects in this mutation or in genetic defects or genetic mutation in this enzyme will definitely lead to defects in the metabolism. Then eventually it in turn leads to the high level of uric acid, which is one of the major cause of causing the gout disease. One of the consequences that gouts, as a result of gout, what will happen that the uric acid crystals will be accumulated more and more in your joints in the form of monosodium urate or MSU. They lead to inflammation, and that inflammation leads to arthritis, pain which caused by this disease. Then also this leads to swelling in the joints, giving rise to the formation of nodular masses, also known as trophy. In soft tissue like these tissues, that are your cartilages, your tendons, etc. These are soft tissues, while the hard tissue, are your bones. So in those soft tissues, these crystals of the uric acids or the monosodium urate, they get more and more accumulated, giving rise to swelling, which ultimately gives rise to the formation of nodules, which is quite painful. Of course, in severe conditions, when it goes on, it acquire a chronic sort of condition, this gout, then you will also have stones in your kidneys. As far as the diagnosis of gout is concerned, examination of the fluid which is present in your joints or tendons like synovial fluid, in that fluid you will see the MSU crystals. Hyperuricemia again is one of the major factor which leads to gout. More and more accumulation of uric acid, there will be more severe form of gout. But this is not the only factor. It's one of the major factors, but not the only factor. There are other factors also, but the major, because we are talking about here the metabolism of the purines, so we will focus more on this aspect of this disease. As far as treatment of gouts are concerned, of course, because of the accumulation of these crystals, it leads to inflammation. You can use many inflammatory drugs like colchicine, indomethacin, etc. Prednisone is also one of the very effective drug. But these are for short term. I mean, if you are facing acute level of acute attack of gout, but for chronic type of gout, you have to treat this disease little bit more strategies. One of the strategies that you can somehow make it possible that more and more uric acid is excreted through the urine, through the agents like or drugs like sulfenpyrazone or probenecid and sulfenpyrazone. Also, you can inhibit the synthesis of uric acid to some extent by using the allopurinol and febuxostate. Again, the two drugs which are involved in the reduction in the synthesis of the uric acid. But of course, as you know, the uric acid has its own importance because it helps in the excretion of the products. This is the excretory product of the purine metabolism. So you have to be careful that how much drug you are taking, because it will also have side effect if uric acid is not being produced at all. Another consequence of the defects in the purine metabolism is the ADA deficiency. This is again adenosine deaminase. This is a very important enzyme, and as a result of the defects, what will happen that you will have accumulation of adenosine in your body, which will ultimately leads to many effects. One of these, there will be more and more accumulation of deoxy ATP, and also the inhibition of ribonucleotide reductase, which is involved in the formation of DNA, which ultimately leads to, because the inhibition of ribonucleotide reductase will lead to the inhibition in the formation of DNA. Also, it has impact on your immune system, very severe impact on your immune system. That's why it's also known as severe combined immunodeficiency disease, SCID. It is as a result of this, because it's your immune system is affected. Of course, the immune cells will be also their production will be affected. So as a result, you will have decreased T cells, decreased B cell, and natural killer cells. So your whole immune system is compromised because of the ADA deficiency. In USA, for instance, one of the most developed countries, still there, 14% of the SCID cases are found in US. No much treatment options are available. I mean, once you have SCID, it's really a big challenge. One of the ways that you have bone marrow transplantation, of course, which is not possible for everyone, but that is one of the way. And if you don't treat the prognosis without it, I mean, the prognosis are not good. A child who have this disease, he will not cross age of 2. They usually die within the age of 2 or 2.5 years. That show the severity of this disease.